Welcome back to the deep dive. We've got a really important topic this time, based on the sources you shared, getting a handle on depression.
Yeah, it's definitely significant.
So, our mission today is basically to unpack the core ideas from this material,
Mm.
what depression actually is, how psychology sort of categorizes it, and what the main treatment approaches look like.
Exactly. Think of it as a way to get quickly up to speed.
We're diving into primarily excerpts from a psychology book. It's called Hayu Her Vinotam Lihome C.PDF, which, well, it translates to something like Understanding All About Psychology.
Right. And it seems like a solid resource for tackling these key areas you just laid out. The definition and characteristics, the classification piece, and then, the treatment options.
And it really hits home how relevant this all is. I mean, one thing in the materials it mentioned, 615 million people globally
Yeah.
living with anxiety and depressive disorders. That number is just,
Well,
it's huge.
it really is staggering. And connects to that other stat, doesn't it?
You mean the treatment rate? Yeah. It said treatment for depression has shot up over 400% since 1988.
Which is quite something, over 400%.
It makes you wonder, right? Is it more awareness, less stigma, maybe, or perhaps just changes in how we even diagnose it?
That's a really good point, that 400%. It's not just a number, is it? It probably points to a pretty big shift in how we're looking at mental health as a society.
Yeah.
Are more people actually experiencing depression or are more just seeking help? Or both. Worth keeping in mind, I think.
Definitely. So let's start at the beginning. Based on this Understanding All About Psychology book, what's the foundation? How do they define depression?
Okay, so the book starts by explaining that psychological disorders in general, depression included, they tend to show up as these recurring negative thoughts, emotions, and behavior.
Recurring patterns, okay.
But the key thing, the point where it crosses a line, maybe, is when these patterns become really persistent.
Mm.
They stick around and start messing with your daily life significantly.
So it's not just having a bad day or two, it's more than that.
Exactly. It's about the duration and how much it impacts you. The text also touches on the emotional side of things,
Yeah.
mentions that something like 85% of new mothers get the baby blues.
Oh, right. I saw that.
Now, the book is clear that's not the same as clinical depression,
Okay.
but it's a good example, maybe, of how big life events can really, swing your mood.
That makes sense. It sort of highlights that emotions fluctuate, but the baby blues are usually tied to something specific and they're temporary.
Precisely. Whereas clinical depression, as the book seems to frame it, is, well, deeper, more
Mm.
pervasive.
And it fits with that other statistic, too, that something like 12% of the general population experiences episodes of depression. Well, it's more than 1 in 10 people.
It is.
Yeah.
Which really underlines why we need to understand the specifics. The source really hammers home that for these symptoms like feeling constantly sad or losing interest in things, maybe changes in sleep or eating, for those to actually be seen as depression, diagnosed and treated,
Right.
they have to kind of fit together, form a clear, recognizable pattern. It's not just one or two things happening in isolation.
Right, right. It's like putting puzzle pieces together. A few scattered pieces don't mean much, but when enough fit together, you see the whole picture.
That's a great analogy, yeah. It's a specific cluster, not just random negative feelings.
Okay, so we have a better sense of what it looks like. Now, where does this fit in the bigger picture of psychology, according to this book?
Right, so classification,
Mm.
the book itself, Understanding All About Psychology, obviously falls under psychology.
Mhm.
The scientific study of the mind and behavior, right?
Mm.
It looks at our thoughts, emotions, actions, all that complexity.
Makes sense.
And within that big field, the book has this specific section, Kakrul Tamli, psychological disorders. The table of contents says that starts on page 34.
Page 34, so pretty early on. That placement alone suggests it's a core category, doesn't it? Like, it's putting depression firmly within this framework of disorders.
Exactly. It's not just presented as, a general problem of living, but as a specific type of condition within mental health.
And I remember seeing in the table of contents, there were, like, lots of other conditions listed around it.
Yeah, suggests a whole system, right?
Uh-huh. A structured way of organizing different mental health issues.
Precisely. Psychology uses this classification system. Think of things like anxiety disorders, personality disorders, etc., to, well, organize things. But it's not just for tidiness. It has real-world importance. Why do you think that structure is so vital for, say, clinicians.
Well, I'd imagine it's crucial for getting the diagnosis right. If you have clear categories based on symptom patterns, it must help doctors tell the difference between, say, depression and maybe an anxiety disorder, even if some symptoms overlap.
Good point. There can definitely be overlap.
And getting that diagnosis right, that must be the first step towards figuring out the best way to help someone, the right treatment.
Couldn't have said it better. It's like a medical doctor needing to know if it's a bacterial or viral infection before prescribing treatment. This classification helps mental health professionals choose the most appropriate, evidence-based approach for what someone's actually dealing with.
Okay, that makes a lot of sense. So that leads us naturally to the next part. Treatment. What does the book say about how depression is treated?
All right, so treatment. The book has another major section. This one's called Kakliophap Tro Leucha Tierge, which is basically therapeutic treatments and healing. That kicks off on page 110.
Page 110. Okay, so a dedicated chunk of the book.
Definitely. It signals that the source takes treatment seriously. And like you noticed before with the disorders, the table of contents lists various types of therapy.
Yeah, I saw those names. Liufaptaman, psychodynamic therapy, and Lufapnintakanvi, cognitive behavioral therapy.
That's right. And Liufabnan humanistic therapy, too. Those are some of the big players in psychotherapy. What does seeing those different approaches suggest to you?
It suggests there's no single magic bullet, I guess. Different therapies must work differently, maybe focusing on, I don't know, past stuff or current thinking patterns or maybe more about personal growth.
That's a really insightful way to put it. They do operate on different ideas and use different methods. CBT, for instance, cognitive behavioral therapy, that one really zooms in on changing those unhelpful thoughts and behaviors that feed into depression.
Okay.
Whereas psychodynamic therapy might dig more into unconscious drivers or early life experiences to figure out the roots of the feelings.
So different angles. But it's not all just talking, is it? I think I saw something else. Leofops and Huck. Biological therapy. That sounds more medical, page 140.
Spot on. Biological therapy. That covers treatments targeting the biology of the brain and body. And yeah, medication is a huge part of that for depression.
Ah, okay. So medication fits under that umbrella.
It does.
Oh.
The source likely details the different classes of meds used. And thinking back to that statistic we talked about earlier,
Yeah.
the big jump in antidepressant use.
The 400% one.
Yeah. What does that trend possibly suggest about how we manage depression now?
Well, it seems like medication has become a much bigger part of the picture. Maybe it's just easier to access, or maybe your understanding of the biological side of depression has grown. Could be lots of things, I suppose.
It likely reflects a mix of factors, yeah. Increased diagnosis, changing guidelines, maybe patient preference too.
And the book mentioned different types of meds, right? Like antidepressants, but also anti-anxiety ones, mood stabilizers.
Exactly.
Right.
Which tells us that even within medication, it's not a one-size-fits-all approach either. Doctors think about the specific kind of brain chemistry imbalances they suspect might be involved when they choose a particular drug. It's meant to be targeted.
Okay, got it.
Yeah.
So let's try and wrap this up. Pulling it all together from these sources. Depression is basically this pattern, right? Persistent negative thoughts, feelings, behaviors that really get in the way of life.
Dick.
Psychology classifies it as a specific psychological disorder.
Within a larger system.
And thankfully, there are treatments. Different kinds of talk therapy that look at the psychological side and also biological treatments, especially medication, targeting the brain chemistry side.
That's a great summary. Covers the key points nicely.
And coming back to that massive number, 615 million people affected globally by anxiety and depression.
It really puts it all in perspective.
Yeah, and combined with that big rise in people seeking treatment, it shows how widespread this is, but also maybe that there's a growing willingness to address it.
It does suggest a positive trend towards recognition and seeking help, which is definitely encouraging.
Absolutely. So as we finish this deep dive, maybe something for everyone listening to think about, given how common depression is becoming, or at least how much more we're recognizing it, and with all these different treatments available, what's our role, like, as a society? How do we build communities that are genuinely more understanding and supportive when it comes to mental well-being?
That's a powerful question. It really pushes us to think beyond just the individual level.
Yeah, something to mull over. Thanks for diving deep with us today.